Our names are Jordan, Jessica, Eve, and Jean Vincent. We did our social action placement with the Fredericton Public Library. We explored the need for social workers in the public library system, widely regarded as the last free space in the public sphere. Drawing on our love for stories and narrative and that of our supervisors, we thought it would be fitting to present our placement and the social issue through a narrative lens. The following stories explore the current role of libraries in communities as well as the imagined role. And so the story begins.
A man named Alfred gets woken up gruffly at 6 a.m., his tired old bones screaming in defiance. He has an hour and a half to gather his belongings, eat his meager oatmeal, and head out of the shelter for the day. It doesn't matter that it's minus 36 degrees. It doesn't matter that the man's sleep was disrupted by opiates. Rules are rules. Alfred goes to King's Place, the downtown shopping center in Fredericton, to get out of the cold and use the washroom. Move on, no loitering or panhandling, unless you want a fine. Alfred doesn't bother to argue, but he doesn't know where else to go. He doesn't know who can help. He is new to homelessness and is afraid to ask. He doesn't want to be labeled or looked down upon. Go to the library if you want to loiter, the security guard mumbles. As Alfred enters the library, he notices another security guard eyeing him down. Great, he thinks. Here we go again. At least I'll be warm.
Across the city, on the north side of Fredericton, Tao, a single mother, pulls her 4-year-old son by his hand while holding his baby sister close to her chest. She makes eye contact with the car coming towards her as she starts to cross the street. The car speeds past, splashing snow and slush on Tao and her children. The driver gives her a dirty look. She sighs, feeling more isolated and frustrated than she had before. Being a newcomer to the city from Vietnam, she finds herself struggling to understand the cultural norms of New Brunswick. Tao's daughter begins to cry. She knows her baby is hungry. Once again, this month, she must choose between feeding her children or making her rent on time. She zips up her son's flimsy winter jacket, and they begin to walk across town to the public library. She's desperate to improve her English, and is startled by the librarian's welcoming smile as her family stumbles through the front doors of the public library.
Fran has been a library clerk at Fredericton Public Library for 15 years. She encounters hundreds of people per day, some of which she knows by name. Fran enjoys her job and loves her patron, but in recent years she has noticed a change in the library and the needs of her patron has become more complex. When Fran gets home, she finds it hard to relax and feels that her work has been emotionally draining, even traumatizing. Fran is still rattled as she reflects on an incident yesterday in the library. One of the patrons was sitting, slumped over in the computer lab. As Fran approached, she noticed empty pill bottles sitting on the desk beside him. Fran's heart began to race, and panic set in. She realized that he had overdosed and ran to call 911. Fran has found herself doing things she's not trained for. Sometimes things get so out of hand she ends up calling the police for help. She knows there must be a better way to help, but she just doesn't know how.
At the local nonprofit community health center, Tammy works with multiple service users every day. She tries to help the best she can, but at the end of the day, her efforts are only a drop in the bucket. She knows there are endless needs in her community. Tammy's organization loves to help its service users, but she knows there are many people in the community her organization is not reaching. The library is remaining afloat. It's helping people the best it can with the limited resources it has. But could it help more?
What if Alfred was greeted by a social worker instead of a security guard? And if the social worker could help Alfred connect with the organization's resources and services he needs in a stigma-free environment? Now imagine if the social worker could be there for Alfred to lend an ear or offer a kind word, helping him when things get so overwhelming he feels like exploding at the library staff.
What if Tao could find not only books, but also community? A social worker could be there to connect her with multicultural organizations in Fredericton, where she could build new relationships. Imagine this social worker helping Tao access food for her family and services to help her pay for her rent and adjust to a new culture. This same social worker would take the time to build a relationship with Tao and ensure she is supported at a time when she is feeling lonely and lost.
What if Fran was able to lean on and learn from a social worker trained in de-escalating complex situations? The social worker could design and provide training specific to the needs of library staff and ensure they can fulfill their library missions. The social worker could provide debriefing after stressful situations and begin the process of dealing with their own traumatic work experiences. The police and emergency services wouldn't have to spend expensive resources and time to address issues at the library because those issues were addressed in-house with empathy.
What if this social worker could help address one of the biggest flaws of our current social service models, gaps in access to services? A social worker would improve the efficiency of partnering social service and public health agencies, providing a safety net to help catch the folks who have slipped through the cracks. Libraries are changing. They're no longer just a place to check out books. They're a place where people gather and a place where all are welcome. What if, at the library, we don't just survive, we thrive?